I have a student in Michigan. I was delighted to see this write-up because it verifies what I'm going to tell you now. We had been working for quite a while with impotence and frigidity when a couple of the doctors came to class and said, "Mr. Ellman, it works so well in frigidity and impotence. Why shouldn't hypnosis be used in sterility cases?" And I said, "Well, that's a different thing. We know that impotence and frigidity is strictly emotional, but when it comes to sterility, I don't know that that's emotional." And he said, "Well," he said, "just figure this way. Our own medical figures show that when couples adopt babies, that 20% of those couples who adopt babies become pregnant within 2 years." And I said, "Oh, if that's the case, then there's a high emotional content in sterility." And I said, "That's right. Do you think that there's any hypnotic technique which might aid in solving the problems of sterility?" I didn't know of any because I'm a layman. And so that night, the two doctors and the rest of the class canceled out the lesson, and we began working out an experiment to see if we couldn't correct sterility problem. Now let me tell you what happened. We finally worked out a technique, or that is, they finally worked out a technique. I was just a listener with an occasional word. And they felt that in order to do it on a scientific basis, they had to have a control group and an experimental group. And they figured that the least they could use would be 20 cases of sterility. 10 in which suggestions were going to be used in the manner that I will soon indicate, and 10 to be used just as a control group to see where the results were the best. At the end of a year's time, it wasn't a year's time even, it was much less than a year. In less than a year's time, here's what had happened. In the 10 where nothing was done, 2 out of the 10 became pregnant. Where suggestion was used, 8 out of 10 became pregnant. This was such a fabulous result, such a dramatic thing, the figures utterly reversed, that I spent 3 days calling up every doctor who had ever studied with me, telling them the results of the experimentation and telling them to use this technique for correcting sterility. Here's the technique. It's right in the outline. And I understand you don't even have to go by the temperature chart, but remember, this was worked out years ago, and we didn't know too much about it. And this was the first work ever done, I think, on a scientific basis on this particular problem. Work by the temperature chart. Keep the couple separated sexually until time of ovulation. On or about the day that ovulation is due, put the wife into somnambulism and give her the suggestion that she will be very desirous of her husband sexually that night. Put the husband into somnambulism and tell him that tonight you will have the potency of a 15-year-old boy. When you are sure each has taken the suggestions given, send them home. Repeat the therapy for 3 successive months. And gentlemen, it works. Let me tell you how well it works. Doctor, how many cases of sterility do you have in your practice at the present time?
I really don't know. I'd say I wouldn't even guess that. It's not an awfully large number.
How many have you used this technique on?
I've only used it, I'm sorry to say, this one time.
How'd it work for you?
I had no results. However, I was just sitting here thinking about what you're talking. We have an organic problem in this particular case.
Well, no. You've got to eliminate the organic problems completely. Doctor, have you used the technique?
Well, I tell you, that's the main reason I wanted to make this particular meeting today, was I wanted to start using it, and I haven't used it in the past.
Well,
it just got, I don't know, maybe I spent so much time the first time through this course on these other things that I didn't get to this one. And it just hasn't been clear to me. That's why I want to come back today together.
Well, all I can tell you is that it's a darn shame that the doctors out here are not doing this, or that is that those of you who come back to class are not using this technique, because I can ask anybody who has used this technique that has studied with me, and the results have been absolutely phenomenal. Dr. August, in speaking to a convention on the study of sterility. What is that society? You're an OB work doctor. What's that thing that was just held in the past couple of weeks?
Sterility and infertility.
That's right. He gave a lecture there in which he commented upon, not only commented, but talked for a couple of hours on this technique and said that it is a priceless technique. And I've got the write-up down in the car. I meant to bring it in today. In fact, we've got to bring it in for every session as we go through the next 2 weeks, because I want the doctors to know how successful this technique is. I hope you will start using it. And gentlemen, those of you who are hearing me for the first time say this, start using it. You will be surprised at what good results you have. Dr. August is not the first one to make talks before such groups as this Society for the Study of Infertility. I don't know the scientific name of it, but I know that there's been papers read by my students at your OB meetings, your OBGYN meetings, and there's been papers read by my students at so many different places. And when these men get up and say that this technique works, they're just verifying what was discovered by us way back in 1952 when we first began using this. Now, you're going to find that if you use that technique, you're going to be successful about 8 out of 10 times. August seems to think that you're successful even more than 8 out of 10 times, and says it is the preferred technique, according to the write-up which we have on the speech that he made. Try it, gentlemen. You will find that it works. There are a couple, however, on whom it doesn't work. For example, when we found out that 8 out of the 10 who had suggestion got pregnant and 2 didn't, we soon began to find out that this happened in more cases than you would expect. That is, a doctor would report if he had 4 cases of sterility. He'd say, I was successful with 3, but I missed on the 4th. And then somebody would say, I've been successful in all 6 cases. And then another one would say, I've been successful in all 3 cases. And then someone else would say, I worked it on 2, but I wasn't successful on the 3rd one. Always there were some that did not respond to this technique. And Pauline and I, over the years, as we got reports from old students on how successful they'd been with it, began to do some analyzing and saying to ourselves, what happens to those 2 that don't seem to get pregnant? What could we do to find out what happens to them? Why don't they get pregnant? All 10 couples got suggestions, and 2 couples didn't get pregnant. Now, let's find out, if we can, what happens to those 2 couples. Well, we were teaching in an area where we had taught before, and this doctor and his wife come to class, and he asked us if we would join him for a midnight snack. We said yes, and after class was over, we went up to his house. I can remember the doctor and I sitting in the living room, Pauline and his wife preparing the midnight snack out in the kitchen. He's a good-natured gentleman, and he starts chuckling, and he says, you know, Dave, this hypnosis is the most fabulous subject in the world. He says, one of the most amusing parts of the whole thing is how successful you are in unexpected ways. He says, for example, I happen to be one of those fellows who just loved what you said about sterility, and having a number of sterility problems in my practice, I decided to use that technique and see what happened, with the result that every woman that I used it on became pregnant. And he chuckled. He says, every one became pregnant. All except my wife. Will you tell me why I can't make my wife pregnant? I've been trying ever since we got married. And they've been married for about 5 years. So I said, uh-oh, this is one of those cases. If I could do hypnoanalysis, maybe I could find out why 2 of these people don't become pregnant and the other 8 do. It would answer something. So I did hypnoanalysis on her first, with his consent and with her consent. And the instant I got her into hypnoanalysis, here's what I found out. Now remember, at surface level, both of them professed to want a baby. Oh, That was the thing they wanted mostest in the world. And now in hypnoanalysis, she says, he only accepts me as half a wife. If he doesn't accept me completely as a wife, I'll never let him make me pregnant, never in a million years. Well, what's it all about? Well, for one thing, I'm 32, he's 52, and he thinks because he's 20 years older than I am, that I can't possibly love him the way I would love a man of my own age. He says that I represent, that he represents to me in my own mind a father figure and things like that. And so he doesn't accept me as a complete wife, he treats me as a child, and if he won't treat me as an adult and a full and complete wife, I'll never let him make me pregnant, never. I said, there must be more to it than that. He says, there is more to it than that. I'm medically trained, and he knows I'm medically trained, just like he's medically trained. And he won't let me work alongside him. He says that that's how doctors and their wives constantly get into quarrels, and that's what leads to divorces in doctors' lives, and he's not going to let any wife of his work alongside him. And I told him about you and your wife and how you two work alongside of each other all the time. And I told him about so many other people who work together all the time. But no, he says that I can work in any other doctor's office, but I cannot work in his office. And Mr. Elman, he's not accepting me as a wife. Until he accepts me as a wife, I won't let him make me pregnant. Now, I do hypnoanalysis on him. And I find out that what she is telling is the absolute truth. He verifies everything she has said. And when I try to change his mind on it, try to get him over the notion that that he represented a father figure to her, I said, Doctor, you've been just reading the wrong books on psychiatry. Or you haven't been reading enough of them. After all, 20 years isn't such a great difference, and this woman certainly sees in you a fine figure of a man and says to herself, this is my man. And she loves you. There are many cases of women who've been married to men 20 years their senior where the marriage is 100% a success. And I said, your marriage is 100% success if you accept her as a wife. And he said, now, Dave, you know, you can tell that to others, but you can't tell that to me because after all, I'm 20 years older than she is. She couldn't possibly love me like she would love a man, say, 34 or 35, right around her own age. Our interests have to be different because we're so diverse in age and so on. Anyhow, that couple will never get pregnant. Another case. It hadn't been many weeks after I worked with this one case and determined in my own mind that inner conflicts make pregnancy impossible in certain instances, when I had another occasion to do hypnoanalysis on a doctor and his wife. Here was the story on this doctor. They had a boy who was 9 years old at the time, and for 9 years they had been trying to have another child so that the 9-year-old could have a brother or a sister. Now here's what happened. When I put him into hypnoanalysis, I found out that he wanted a baby and that there was nothing on earth holding him back. And he's very much a man. Then I did hypnoanalysis on her, and this is what I found out. That she was the belle of the campus, and he was the hero of the campus. And they were keeping company with the idea that they would get married in about 2 years. And she said, and Mr. Elman, he seduced me. The first time I ever had anything to do with him. And I was just an innocent girl. I got pregnant the first time, and if he thinks he's ever going to make me pregnant again, he's very much mistaken. We had to get married, and if he thinks he's ever going to make me pregnant, he's very much mistaken. Now, we've had enough experience by this time with these tension cases, where we know that there are inner tensions present, to be able to say to you in all sincerity and all honesty that when you encounter a case like that, and hypnoanalysis reveals the cause of the sterility to be those inner tensions, there's only one man in medicine who is trained to handle those inner tensions, and that man is your psychiatrist. Strangely enough, where we have turned such cases as that over to a good psychiatrist, in many cases he solves these inner conflicts and the wife gets pregnant. Now, you say to the average psychiatrist, do you know that you can handle cases like that? He said, no, I've never tried one like that. And I've had psychiatrists write in my own classes who've said this. But you talk to other psychiatrists who have handled these cases successfully. For example, here's one of the most respected psychiatrists in America, I think, in Chicago, who's been a student in this class. And I said to him once, I said, Sam, why is it that you psychiatrists are successful in handling these cases, whereas the usual MD fails? And he says, well, it's so easy to understand why. He says, after all we do is to resolve the inner conflicts. And when you get those inner conflicts resolved, the tensions disappear, and the pregnancy rejection disappears. That is, the emotional pregnancy rejection. And then pregnancy can occur. And it does occur once those tensions are released. So I would say to you that where you aren't able to make headway with the technique that I've told you about, do hypnoanalysis. Find out if it isn't a case of one of those inner tensions that aren't revealed readily at surface level. And then once you've got it in your mind as to what causes the pregnancy rejection, then turn the case over to the psychiatrist. The chances are you'll find that pregnancy will occur a few months thereafter. I'll venture to say there are many doctors here who have already used hypnosis to relieve headaches. How many of you have done that? Gee, look at the hands go up. But how many of you have also done it to relieve dysmenorrhea? One hand goes up, old students only. Now, do you know that dysmenorrhea responds as fast as a headache responds? That your dysmenorrhea vanishes instantaneously? You know, this is the most amazing thing to me. That doctors will use this constantly to remove migraines, yet let a patient come into them complaining of the most dreadful dysmenorrhea. And it never even occurs to the doctor to say, let's relax that dysmenorrhea right out of your system. If they came in with a headache, you'd say, gee, I can help you with that instantly. Here, let's relax a little bit and get that out of your system. And you would help the patient with a headache. But ask the woman who has dysmenorrhea if dysmenorrhea isn't just as disagreeable as a violent headache. And she'll tell you it is. And that woman deserves relief, and it can be done over the telephone. Just like you can relieve a migraine over the telephone. You can also relieve dysmenorrhea over the telephone. Now, yes, doctor?
There's so many of these dysmenorrheas that don't want to be relieved. They want something to complain about. They got away from, they have no defense.
Well, doctor, then you'll only be successful in taking that one away from them, and the next period it'll come right back on.
You got to substitute something else for it. You'll have an erotic case.
No, you don't. No, you don't. That's not so. That's an old fallacy. That's an old grandmother's tale. It was told to us in hypnosis. We all had that training. You know what I mean? And I don't mean to disagree with you, doctor. I just want to point out something to you. What will happen is they will reject your suggestion about relief for the dysmenorrhea if they're holding on to it for a reason, if there's a functional purpose back. Well, all dysmenorrhea is a functional symptom. We know that. But where it has a very definite purpose, and you give a patient a suggestion for the relief of dysmenorrhea, what will happen is that you won't be effective with your suggestion. They'll still hold on to the dysmenorrhea, but they'll never substitute something else for it, doctor. Never. In all the time that I have been working with hypnosis and in all the cases that I have dealt with, I still have to be given valid proof that a substitution can be made intentionally by hypnosis and be made to stay, or that a transfer will occur in the use of hypnosis. In fact, I am so confident that these things cannot occur, doctor, that I've had a standing offer that anyone who can prove that will get $1,000. I mean, that's how certain I am that I am right. That if you can prove that, and look, that's open to all of my students, because I'm trying to learn. You know what I mean? This isn't done in the way of a challenge. Believe me, it isn't. Because I don't know all there is to know about hypnosis, but I'm trying to learn. And in order to learn, if anybody in the world ever succeeds in obtaining a definite transfer or a valid substitute in the case of a hypnotic suggestion, a lasting substitute, then the $1,000 is theirs.
Maybe true, but I venture to say every doctor that's had much experience, you get one complaint away from an individual, man or woman, and
other complaints will manifest themselves.
You'll be right back with another one that's just as equally important to them. You get rid of that one, and they're right back with another one.
Yeah, unless you... Yes, unless you get back to the cause, but not on a hypnotic basis, doctor. You get rid of a woman's dysmenorrhea, she won't come back with another complaint. But what will happen is she'll have the dysmenorrhea next month again. Suppose now that you haven't succeeded in removing the dysmenorrhea at all, and that can happen with suggestion. I'll venture to say that some of our old students will tell you that they haven't always succeeded in removing the dysmenorrhea. She'll hold on to the symptom if she doesn't want to let it go, but she'll let it go for that time usually. They will not alter their symptoms with hypnosis. Now, what will happen is this, doctor, and this is quite true, that when you talk them out of their symptoms, not hypnotically, but I mean by psychiatry.
Hypnosis.
Huh?
Waking suggestion.
No, well, no, I'm thinking of it from the psychiatric angle. That it's in psychiatry that they find the substitution of symptom taking place and so on, and the transfers taking place. And
the psychiatrists say something that the symptoms ascend. They'll continue to ascend in the body, and when they get to the neck, why, they can go berserk.
oh, that's a...
I've heard that ascending symptom.
Yeah, it's somebody's crazy theory.
Caution you to avoid that.
They do, huh?
Yeah, I don't remember the details of it. Is it ascending?
Well, doctor, you'd have to give me a lot of... You'd have to reteach me certain things that I have been studying all my lifetime to make me believe that there's any credence to that at all. Certainly, the ear is a part of the head. The nose and throat is a part of the head. And I have had symptoms, sinus conditions, asthmas, bronchitises, ear conditions, and everything else. And those people have not gone berserk. So if the theory was valid,
no,
doctor...
I mean, suppose he had a pain in his lower abdomen, and then it ascended to his chest, and then he had a pain in the neck. Well, then you'd know that the next substitution symptom might be a dangerous, because it might be in his head.
That's some silly theory that wouldn't hold water for 2 minutes. Yes, Dr. What?
Do you ever have a transference in alcoholics?
I don't know, Doctor, because I haven't done enough work with alcoholics to be able to tell you that at all.
Because I've read, I don't know how much truth there is, that you can have a transfer to narcotics or something like that.
Oh, that's standard, and the alcoholic, his next step is usually a drug. If the thing he's trying to escape from becomes so violent in his own mind that he can't escape from it with liquor, he'll take the next escape mechanism, which is even a more violent escape mechanism, and he'll take drugs. It doesn't take much to take the alcoholic and convince him that he ought to try a shot in the arm or something, you know. I can see that.
I've had a fair amount of experience with dysmenorrhea, and I can only recall one that I couldn't do anything at all about relieving her dysmenorrhea, and of she was a neurotic mess.
Yeah.
She just her period was just like a vacation, and then the day after her period ended, it was something else, and she just had one neurosis for every day of the month. But with the exception of her, all the rest of them I've had have done very well. But the usual thing I found hasn't been that I could get rid of their dysmenorrhea, and then it was gone for good. The usual experience I have is that the dysmenorrhea comes back every month, but through autosuggestion, they can take care of it themselves.
Mm-hmm.
And they have no problem with it. They'll come back, and I'll ask them how the last period went, and they said, well, it just went fine. Did you have any cramps? Well, I started to get cramps the first day or the day before, and I relaxed myself, and they were gone.
Mm-hmm.
So they'll at least get the beginning of it, every month, and the vast majority of them are that way, but it's no problem for them to get rid of it themselves.
The biggest problem that I've seen over the years with dysmenorrhea is the young daughter of 14 to 17, 18. Usually an only daughter is the worst one, or the oldest. And her dysmenorrhea is her purpose of it, subconsciously, is to get attention.
Yes, I can believe that.
And the mother to get the petting. And as soon as that disappears for some reason, and not why she's got her dysmenorrhea back, it doesn't make much difference. I've seen that over the years.
That I can believe because we have even known enuresis to be an attention getter that they'll hold on to for well, you know, into their adult years. So it's easy to understand how a little girl of 14, 15, 16, 17, around in there, even younger, 11, 12, 13, and so on, would get dysmenorrhea because she's heard mother refer to it as the curse and various other unpleasant connotations given to it until she believes that she ought to be sick at the time of it, and so mother is very sympathetic to daughter. That much I can believe, that as an attention getter, it would be valid.
I don't know how to get rid of it. I've tried
Well,
all my life since I was a doctor.
Well, I'll tell you, doctor, have you tried hypnosis for it?
Yes.
You get them, I wonder if you use our technique for it, though. I wonder if you're not using one of the techniques that you used many years before. What I do, doctor, is this. In order to get rid of dysmenorrhea, I'll start by saying to the patient something like this. You know that all dysmenorrhea says tension. Inner tensions. Relax that inner tension out of your system, and the dysmenorrhea has to go. Now let me show you how to relax that inner tension right out of your system. Then I'll take them down to the physical relaxation. I'll say, notice how much better you feel just as a result of the physical relaxation. Now watch how much better you feel when we get the mental relaxation along with the physical relaxation. Then I take them down to the mental relaxation. And then I say, now notice how good you feel. Now I'm going to count to 10, and you continue to relax as I count to 10, and that dysmenorrhea will completely vanish. And then I count to 10, and then the dysmenorrhea is gone.
When I did that, they wake up. They don't want to relax. Right then, when they don't want to be helped, they're afraid.
If they don't want to be helped, doctor, you can't do it. But I don't think that you're not wanting to be helped case will occur once in 25 times. I'm convinced of that. I've seen some pretty violent cases of dysmenorrhea, doctor. They don't call me into their offices for mild cases of dysmenorrhea. It's when the woman is in agony that I'm called in. I don't think that 1 in 25 will refuse suggestion for relief of dysmenorrhea. Doctor, how successful have you been with dysmenorrhea?
Well, that came right up this morning how to do this, to analyze the patient.
Oh, doctor, I've done hypnoanalysis on dysmenorrhea patients, and it is such a long, drawn-out procedure. You work and you work and you work, and the results are so unsatisfactory, so far as I am concerned, that finally I said, oh, it's too long drawn out. I just can't take the time for it. And finally I said, oh, look, as long as you can get rid of it with superficial suggestion, why worry about the hypnoanalysis? I'm not saying that if you've got the time and want to take it, that for experience and learning hypnosis the way you should learn it, that you shouldn't do hypnoanalysis on a few dysmenorrheas to get experience just as I have done. But when it finally gets you to the point where you say, oh, this is a lot of nonsense, you just work and work and work endlessly, and you don't get it at the first visit, you don't get it at the second, and sometimes you have to see them about 6 or 7 or 8 times before you've got down to the root of what has been causing the dysmenorrhea. It isn't as fast as you would imagine. For instance, with a headache, we can track it right down instantly. But now you find out that it's because her boyfriend smiled at another girl, and now she's got dysmenorrhea. You know, you don't know what the cause is. It just shows up in so many various ways.